you've got such a presence, and you're a voice for probably both sides of the fence, aren't you? So for the patients and for the the surgeons themselves. Well done.
Thank you. Yeah, initially I was definitely just a voice for the patients, but this year especially, I've sort of taken on the subject of helping doctors teach patients how to be better patients, if that makes sense. There was a big issue that was happening in the MARPE, MSE, doctor patient relationship world where patients were coming in with, from the internet and sort of creeping out the doctors, asking too many questions in an inappropriate way. Not that you can't ask questions, of course you can, but they were coming in and throwing all these red flags, and then doctors were getting back to me and saying, "Hey, look, I'm having to turn away these patients. I don't want any more of these patients because of you know their personality as they approach me in the initial consult." And so I did an interview with Dr. Ting where we sort of talked about the more appropriate way or skillful way for patients to approach their doctors if they want to get some of these jaw augmentation procedures done. And so you're right, though. I try to function as like a mediator between patient and doctor in the airway jaw expansion space.
Well, it's there are two languages within the universality of English, and you've got how doctors talk and how they know how to promote or describe what they do, and of course the language that we have amongst surgeons, and then somehow you'll be the translator into a different language, which is the layman's point of view. And there's certainly a community conversation going on about jaw surgery. It's been going on and building now for, I'd say, for the last 12, 13 years. Prior to that, there wasn't an audience for the discussion. Um, uh, I've just been, you know, patsy to it. And
Sure.
certainly I get people making conversational inquiries about me in forums and so forth. But I don't read them. Um, but like the other surgeons, you hear that conversations are taking place.
Yeah. Well, I think if there's conversations taking place about you, that just means that you're one of the A-list providers that people care about and that people are surveying other patients about to, make sure that they're the real deal. So I would take it as a compliment if I were you. Everyone gets mixed things said about them, but what's the saying? Uh, if they're hating on you, it just means you're doing something right. Is really the bottom line, And I
Ho-
don't know that they are hating on you. By the way, I don't read the stuff people say about me online either. If I did,
well,
I would be in a psych ward because some of my early work where I posted my progress photos with some of my early expanders are pretty grotesque. And in the forums, people being anonymous posters do not shy away from telling the blunt truth. So, um,
yeah,
you know,
yeah.
you just gotta take it on the chin and move on, I guess.